A warm welcome to everybody here. My name is Dr. Ngim. I'm a pediatrician in training, and I'm also an academician and researcher based in a clinical school in Johor Bahru. Today, I'm pleased to share with you some of the clinical research that we conduct in our clinical school. Johor Bahru is the most southern city of Peninsular Malaysia. It is also here that our medical students complete the final 3 years of their medical undergraduate training. This is our clinical school in Johor Bahru. And in the third picture here, I'm showing you the Hospital Sultanah Aminah Johor Bahru. This is a large tertiary hospital, which is 1,000 bedded, with many specialties and subspecialties practicing here. Our medical students undergo their training here, and it is also over here that many of the clinical research are carried out. Other sites where we conduct our research are at the multiple community clinics affiliated to Monash University, in the county, as well as in Orang Asli settlement in Johor Bahru. Let me go through some of the main clinical research areas in Johor Bahru. Many of our research is actually a collaboration with our colleagues up in some way, and we conduct research especially in the areas of infectious disease, cardiometabolic studies, microbiome, genomics, and we can see that there are many clinical research in many different specialties based on the research interests of the multiple clinician, academicians, scientists based in our clinical school. Let me now illustrate what are the clinical research that we do in JB using the example of infectious diseases. In this passive surveillance of febrile patients in the county, we received a large grant from the United States Naval Medical Research Unit. And in this study, we aim to study what are the predictors of dengue fever among febrile patients in the county, the diagnostic accuracy of multiple dengue tests being used among patients, and what are the other causes of dengue-like illnesses. Currently, the manuscript has been sent up to a Q1 journal and is being considered for publication. In the meantime, in the last few years, we have done several observational studies in dengue as well among patients in Hospital Sultanah Aminah Johor Bahru, and we hope that they can improve the clinical practice among clinicians. In this study, we look at the impact of dengue virus co-infection. In the second studies, we look at the clinical outcome of severe low platelet counts among patients with dengue fever. In the third study, we look at the association between obesity and dengue fever. And in the last studies, we look at what are the factors that predict a prolonged hospitalization among patients with dengue viral infections. In addition, these are some of the ongoing PhD projects in Clinical School Johor Bahru to show you the variety of projects going on here. The first is conducted among medical undergraduates. The second, among premature babies. The third, among pregnant women with diabetes. And the last, among women who have suffered from several miscarriages. And we hope that this will improve medical education as well as inform healthcare practice in the future. So in a quick summary, the advantages of doing clinical research in JB is you get a good access to a lot of patients with a variety of conditions. You are well supported by clinician scientists who are also teaching our medical students in the clinical schools. And hopefully, your research may have a direct impact on improving clinical practice and informing future research in the future. Thank you.